Now,
Yeah.
how is healthcare system in the UK? I mean, the cost of
Oh,
healthcare.
well, if you are coming to UK as a nurse, or let's say as a skilled worker, you don't pay health surcharge. But for students, they usually pay health surcharge. Even for their dependents, I still talk with a lady that said she paid like 5 million plus because she's going back to Nigeria to take to bring her children. I think three of them. So she says she paid 5,000, 5 million plus. I mean, nine in naira. When
Okay.
she converted to naira, 5 million plus for three kids. So they pay that, and that's a lot for the students that they are bringing in their dependents, or that they will also need to pay for themselves. I know that before they said even nurses, key workers, they pay surcharge, but they've stopped it for them. But students they pay. So for we don't pay any, we don't pay that. And then when we got here, you register with a GP. But I'm not gonna lie to you, to get appointment now, if you have maybe like just normal thing, like maybe you have infection, or maybe you have, but the only thing me I've realized in the UK that emergency case, they are very very you know available for emergency cases. But when it comes to something that take, for me, I like since last year I've been having issue with my tooth, and then I called them. I've In fact, I had to call 111, and then they gave me an appointment because I couldn't even book any appointments. I called all the uh, go for a checkup, because the man said by March I should have got it removed. But the truth is, they've not even called me to come for checkup. Doctors of they will book me for the tooth extraction. So I'm not going to lie, and I think all these things are part of the reason UK now, they too sat down and said a lot of people are coming in their facilities now, telling on their facilities and everything. Because for you to book an appointment now for anything new, like anything, talk of things that can wait for a while. Before they would say okay, within 3 months, within 2 months. Now it's taking 6 months, a year, one and a half. So healthcare is still good. If you want to do any investigation, is free. For people that pay extra charge, they will tell you that's not free because they actually pay for extra charge. You understand? But for people like us, we can say it's free. You know, like there was a time I had issue when I first came to UK. I was having palpitation then, and I don't know if as a result of the cold. So I had to go there. They did ECG for me. They did different tests. That time, thing came out, and I didn't pay nothing. You know. And these are the things that we cannot enjoy in our own place. Even CT scan, they are doing it as if they are doing chest x-ray for people. Chest x-ray in Nigeria is at least you still have your way of doing chest
Yeah.
x-ray. So CT scan, you can travel from Abeokuta to Lagos. You understand what I mean? So all those facilities, they are still available. But at least now, if you are, you know, battling with something that they know is not an emergency, then you might wait forever. You might wait for ages. But you know, averagely, I'm going to say their health system is not bad. Like it's not bad. Even when you go to hospital, if they know that it's not an emergency case, you have to wait for your turn. There might be lots of people there. We've been to hospital before when my um last child, she was having diarrhea, and then we had to wait like 5 hours before we even see doctor. So that's how annoying it can be. But at the end of the day, you will still you know get access to that set, and you'll be fine. So yeah, so basically that's what I can say for their healthcare.
Okay. Well, in the US, health is super expensive.
And
So
now,
one of the reasons why people don't want to come to US is because of the healthcare cost.
mm,
So even though we have Medicaid and Medicare for people who are not making enough or who are not employed, and for people, I mean, for elderly, the old people, the aging population. So, and for people who are working, if you don't have insurance, it's a lot of problems, a lot of, you are paying too much. For
mm,
instance, someone told me that she was having pain in her abdomen, and then she went to the hospital, and then she was seen by a doctor, and when they told her the amount of money, like almost $80,000. $80,000. I don't know how true is that. So without insurance, that can buy you a house in Nigeria.
Exactly.
It,
Exactly.
I was like, even with insurance, you still pay heavily. I remember when I was in the OR, so maybe because I stood for a long time, and I took break. I took a break, maybe 15 minutes break. I was in the lunch room, so I was just having a chest tightness, and I told them that it will go away. They should not worry. They said, no, 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 no. Immediately they got a wheelchair. I said it will go
That's
away.
what they do here too.
So they took me to the ER. They did the EKG, they collected the samples and so on, just check up, with insurance. And I received my amount.
Your
I was
bill.
like $2,500 with
Wow,
insurance.
with insurance.
With insurance. So what will happen if I didn't pay off insurance? I had to pay that money for almost a year. I had to pay small small because I didn't have that money. How will I pay?
Exactly. Honestly, bro,
So
sometimes when you sit down and think about all these things, sometimes you just feel like, exchange rates is what is just the advantages and some other things that we have access to.
exactly, that is the only thing. So like people
Because
used
the
to,
money, you cannot even spend it anyhow where you are.
yeah,
Kai,
exactly.
kai.
Like people used to tell me that, Mr. Brahim, which one is better, UK or US? I said both countries are great countries, they are good.
Hmm,
It depends on what you want.
hmm,
For instance, if you're a child that visits hospital regularly,
hmm,
I would advise to stay in UK
hmm.
because, but US is super expensive. Nobody
See,
prays to be sick in this country. When I was precepting with a doctor, so when I was doing my clinical, so he was precepting me, and we saw some patients, and after them, I now asked him that this insurance of a thing, what can you say about it? He was not happy.
hmm,
He said, Ibrahim, if you're not careful, you will spend your life saving
hmm.
just on health, even with insurance. That's how he said it. That he that is a doctor gone, if
You
anything
know,
happens to him, he can spend his life fortune just because of that with insurance.
hmm,
So what I've seen here is that healthcare is a money making enterprise in the US.
hmm.
It's a money making enterprise. But when it comes to
And anyway, we'll get there. I
so
wanted to say that's the reason why they pay you people much, but I now remember that we are still going to get salary, so it's
yeah,
fine.
so when I was in Nigeria, UTSA, I will see some patients from the UK, from US, come to do surgery in Nigeria. I was like, why would you leave ordinary US to come to do surgery like a
Hmm,
hip replacement? You
hmm,
left US to do hip replacement in the OHSA. Why not do it in the US? When I
hmm,
came, I now realized that
hmm.
super expensive.
Expensive.
Like without insurance, let me even go on Google.
Hmm.
Hip replacement surgery costs in US
Pfizer, please come.
in US that is between $31,000 to $45,000 hip replacement.
Okay, maybe go and open the door for those people. No, 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 that's what I want to ask. Go and open the door. Really? 31,000.
To $45,000. So in Naira, that's about 33 million Naira.
Hey, everybody.
33 million.
Millionaire
33
Naija.
million Naira for hip replacement that you could do in OHSA or Lutz or Lassos for maybe 2 or 3 or 4 million.
Kai.
So, and then with insurance, and then when you call some insurance company, they say you are not covered. I'm sorry, we are sorry, you are not covered. You are not covered. You are not covered. And you will see the patient so down. They will be so, depressed
Sir?
that,
Yeah. Hey, just give me
yeah,
1 second. I'm
yeah.
coming.
So the health cost is expensive in the US. So to limit, to mitigate the cost of health in US, you have to have insurance. Even with the insurance, it's not still cheap. I mean, you still have to pay some amount of money
Hmm.
for healthcare. So it's not easy, even with
Hmm.
insurance. Now I understand why people would leave ordinary US to go and
Come and
have
do surgery
surgery
at
in
home.
Nigeria. Even
Hmm.
in a good hospital in Nigeria, like St. Nicholas or Reddington Hospital, you can't pay that much. You can't even pay
33 million.
32, yeah,
A
33
lot.
million. So and it can be more than that.
Hmm.
For instance, if you want to have a CS in US, I learned that some people pay like $30,000 to have CS.
Hmm.
That's a lot of money.
You
So yeah, just CS. I mean, if you're coming from Nigeria, you want to have a CS in US.
hmm.
I mean, planned US, yeah, CS. So you pay a lot of money.
Hi.
So and then with this expensive healthcare, a lot of people don't still have insurance in the
Hmm.
US. A lot of people don't start insurance. So I wonder how they
They will
cope.
do it.
Yeah.
Well,
But
Naija now, sometimes you have like, oh God, along with you there, this like that, and then, but honestly, it's risky. It's
but
very,
but
very risky.
if you work with the state government,
Mm.
it's not just like you are enjoying free healthcare in the US. If you work with the state government, for instance,
Wow.
people who work in the security in the correction, like
Mm.
officers in the correctional centers. So if you work with the state, like for instance, someone told me that when she had a child birth, she only paid like $50 for everything.
That's
So
interesting.
it's good if you work with the state government.
Mm.
Like if you are still young, you want to work in the military or army, all those things. If you work with the state government, you pay, even you may not even pay anything for health because government, covers, the cost.
Mm.
So that's
Wow.
about the healthcare.
Okay.
So what people do is that when they go to Nigeria, they know how they do. Like if
Yeah.
they're coming back to US, they may buy some herbs, supplements or some medications that are, so
At least.
yes, so that when they come here, they'll be able to use those supplements, those herbs to keep themselves fit. Because in this country, it's not easy. I mean, if you fall sick, maybe because you are not eating well, or you are eating junks, or you are eating anything, and then
Hmm.
you fall sick, you're gonna pay more. For instance, when it comes to like when I first came, I was so economical with electricity. Like sometimes I'll be feeling cold in my house, in my room, and someone came to greet me. I said, "Ibrahim, why not put on the heater?"
Heater.
I said, "No, I don't want to pay too much for the electricity." Oh, you don't want to pay too much for electricity. What if you fall sick? You will pay
Hmm.
more than that. You know that.
Exactly.
Since then,
Exactly.
I started. So it's not
God.
something to be played with.